Hi, welcome to our podcast. We are the team at Celeste Brain Health where we treat a variety of neurologic conditions. I'm Kelly Gill, PA, and this is Dr. Sumal Modi. We're here to talk to you about common neurologic conditions and preventative brain health. Let's dive in. Today, we're tackling something that unfortunately affects many people, especially those who've experienced a head injury, post-concussion syndrome. You know, I think most people have heard of concussions, especially with all the attention on sports these days, but the lingering effects can be a bit of a mystery.
That's right, Kelly. And that's exactly what we are here to shed light on. Post-concussion syndrome can be quite debilitating, and it's often misunderstood.
So, Dr. Modi, for our listeners who might not be familiar, what exactly is post-concussion syndrome?
Well, Kelly, imagine your brain as a delicate, intricate network. A concussion, even a mild one, can disrupt this network. Post-concussion syndrome is essentially when those disruptions linger, causing a variety of symptoms that can last for weeks, months, or even years after the initial injury.
Oh, that sounds pretty scary. How common is this and who is most at risk?
It's more common than you might think, Kelly. Studies suggest that roughly 10 to 20% of individuals who experience a concussion will develop post-concussion syndrome. That's potentially millions of people in the US alone. And while anyone who sustains a head injury can be affected, certain factors like age, previous concussions, and even mental health conditions can increase the risk.
Wow, those are some significant numbers, and I can only imagine how this impacts people's everyday lives.
Absolutely. The symptoms can be quite varied and affect every aspect of person's life. We are talking about things like persistent headaches, dizziness, difficulty concentrating, memory problems, fatigue, sleep disturbances, and even mood changes like irritability and anxiety. These symptoms can make it difficult to work, study, or even perform everyday tasks, impacting not only individuals but also their families and caregivers.
It sounds like it can really turn someone's life upside down, and I imagine there's a significant financial burden associated with this condition, right?
You're absolutely right. The economic costs of post concussion syndrome are substantial. Think about the medical expenses, lost productivity, and the need for rehabilitation services. It all adds up to billions of dollars annually in the US.
So let's delve deeper into the core of this issue. What's actually happening in the brain to cause these prolonged symptoms?
That's a great question, Kelly. And it's something researchers are still actively investigating. One leading theory is that the initial concussion triggers a cascade of events in the brain, leading to inflammation, changes in neurotransmitter levels, and even subtle structural damage. These changes can disrupt the normal functioning of brain circuits, leading to various symptoms we see in post concussion syndrome.
It's like the brain is struggling to recover and rebalance itself after the injury, it sounds like.
Exactly, and it's important to remember that every brain is unique, so the recovery process can vary significantly from person to person.
That makes a lot of sense. So, how is post concussion syndrome diagnosed? Is it just based on symptoms or are there specific tests involved?
Diagnosis primarily relies on a thorough clinical evaluation, Kelly. We take a detailed history of the injury and the symptoms the person is experiencing. Neurological exams can help assess cognitive function, balance, and coordination. In some cases, we might order imaging studies like MRI to rule out other potential causes.
And what about treatment options? Is there a magic cure for post concussion syndrome? My guess is no.
Unfortunately, there is no one size fits all cure, Kelly. Treatment often involves multidisciplinary approach addressing the specific symptoms of and needs of each individual. This might include medications for headaches or sleep disturbances, cognitive rehabilitation to improve memory and concentration, vestibular therapy for dizziness, and even psychotherapy to address mood changes and anxiety.
So, like a lot of things, it's really about tailoring the treatment plan to each individual's needs.
Precisely. And lifestyle factors play a crucial role here. Getting adequate rest, managing stress, eating a healthy diet, and gradually returning to activities can all aid in the recovery process.
Now, Dr. Modi, I know there's still a lot we don't fully understand about post concussion syndrome. Are there any ongoing research efforts or emerging treatments that offer hope for the future?
Absolutely, Kelly. Researchers are exploring various avenues, including new medications, innovative therapies, and even biomarkers that could help us identify individuals at higher risk and personalized treatment strategies. There's also growing interest in the role of lifestyle interventions such as exercises and nutrition in promoting brain healing.
That's encouraging to hear. It sounds like there's a lot of promising work being done in this field.
Indeed, and while there is no easy fix, with the right support and management strategies, most people with post concussion syndrome can significantly improve their quality of life.
This has been a truly insightful conversation, Dr. Modi. Thank you for sharing your expertise with us today.
My pleasure, Kelly. It's always important to raise awareness about these conditions and empower people with knowledge.
And to our listeners, if you or someone you know has experienced a concussion, remember that you're not alone. Don't hesitate to seek holistic medical attention and explore the resources available to you to support your recovery. That's all the time we have today for our episode. Join us next time as we continue to explore the fascinating world of the brain.